Welcome, dear viewers, to our show Natural Medicine. I recently had the pleasure of talking to a doctor about so-called gold implants. I was so fascinated that I wanted to do a second episode with him to introduce you to this innovation. This is really an innovation that can optimize the pain apparatus so well that you can really become pain-free before you have to go into any orthopedic surgery. And this with a very, very high probability. Unfortunately, no one or very few people know this type of treatment. That's why it's important to make this show available to you again today. Stay tuned, we'll get started in a moment. Now I would like to introduce you to the doctor. This is Dr. Med Harald Burgard. Welcome, dear Harald.
Thank you very much, dear Alexander, for the invitation.
I have the greatest respect for you. Actually, you are a hero again, who is able to make people pain-free with this type of technology without having to do surgery, without getting a new hip, without getting a new knee, and so on. And I just want to take this opportunity today to look at this topic again with you and to ask you to explain it again for another group of viewers who are watching for the first time today. So what is it about? What people are specifically characterized here to get healing with a gold implant?
Every person who has arthrosis has pain at some point, which either goes away through the classic procedures, the conservative possibilities, i.e. through tablets or through physiotherapy or through training, or through injections, acupuncture, injections, whatever. But if that doesn't work at some point, then comes the point where the orthopedist says, now you need a new knee joint or now you need a new shoulder or whatever. And these are the patients who can be helped with a gold implant. From my point of view, the sooner, the better. So not just before the operation is necessarily necessary, but rather even earlier. But anyone who has arthrosis, whether in the ankle, in the knee joint, in the hip joint, in the spine, or here on the shoulder, or wherever, or also on the smaller joints, can benefit from the gold implant.
I always have the feeling that an implant is a bigger lump, but these are very, very small, tiny gold pieces, which you insert around the capsule, which then release ions and stop the inflammation process.
Exactly. So we don't do an operation with big cuts and the like, we don't insert a new joint or something like that, but the whole thing is minimally invasive. That means the patient comes, we always have a preliminary meeting, of course, the patient comes, I examine him, then mark the points to the knee joint, I can show you here on a film.
Yes, we have a video right here, and we'll take a quick look at that. Maybe the director can already show the video.
Exactly, here you can see, for example, in the operation, where I have the green dots, the dots are fixed, that's the anesthesia, that's what the patient still notices, that's a little syringe, it doesn't really hurt, and then you don't notice anything anymore. And these dots are then inserted with a needle, fine gold, 24 carat, small pieces, I brought you some, you can have a look, that's really tiny, but that's enough to get people out of pain permanently.
Yes, I don't think you can see that in the camera, that's how small it is.
Well, maybe show it in the picture later.
These are 24 carat alloys, and gold is simply known to be an anti-allergen.
Yes, these are not alloys, pure gold. That's the important thing, it's pure gold doesn't cause allergies, pure gold can be used for that, also for allergies. Here I now put the gold in the knee in the operation, everything is highly sterile, covered with towels, like in a big operation, with sterile gloves, with caps, and so on. That's a minimal intervention, which is done there, and the people can then get up, we put a bandage on it, the people go home, remove it the next day, and can live normally. They can go to work, they can go for a walk on that day, or whatever. Yes, that's minimal, maybe 1 of 10 has a little more pain in the evening, then you need ibuprofen, but that's it. Otherwise, complications are almost non-theoretically possible. So if you go in there with a needle, like with a syringe, you can theoretically set an infection. That's why we do it very sterile. You can injure a blood vessel, you may have a small blood clot, I've never had that, thank God, but it can be, you can injure a nerve, but nothing more happens. So that's a minimally invasive procedure, which doesn't bother people, even in old age. I already have patients here, they were 96 and 89, so really elderly people, who said, I still want to have quality of life, I still want to be able to provide for my partner, but I don't want to be absent for weeks, go to the clinic, that's not necessary here.
If someone with a pain scale of 10 out of 10 points is here with you and gets an implant, and you have said that, does he immediately have a reduction, maybe to 8 or 7?
That would be nice, of course, while the local anesthesia works, yes, but not afterwards, no. That's actually the case, that it takes several weeks until the body has released so many ions out of this little piece of gold, that it is enough to dampen this inflammation that takes place around the joint. That means it can take for weeks, 6 weeks, 8 weeks, usually we're talking about 3 months. We've already had patients, it took longer, but it started. And if enough gold was released, that the pain goes down, then it stays at that level, for decades, or lifelong.
There are many people who also have big problems and always pain in the back. These are also inflammatory processes, not just everything muscular, but also inflammatory processes. That means people can actually get rid of their back pain.
Yes, take a look at the x-rays of many patients, then you can see that there are arthrosis, and arthrosis is an inflammatory stimulus. That means these arthrosis that arise there, through whatever, through a lot of work, through oxidation, through chronic pathogen load. These arthrosis that have arisen there, they constantly fire inflammatory stimuli, and that causes tension in the muscles, that causes permanent pain, and you can go there very nicely. Or also with people who had a disc accident and then had pain, that's also a permanent inflammation. You can go there very nicely and put the gold on the facet joints or the other areas of the pain, and then you have a permanent anti-inflammatory effect there.
I'm just speechless. I have to be honest, I'm totally speechless, because it's so logical and helpful, but on the other hand, we torture ourselves with pain for 20 to 30 years. At some point it's unbearable, quality of life equals 0, now you really go to the doctor, get an operation, but for 20 years you torture yourself with painkillers, which also has effects, and instead, we could just do a small operation. Well, it's not an operation, it's an injection, with gold implants, and that's it, right?
Yes, it's a procedure that can help a lot of people, that's not invasive, where you keep your own joints, and the nice thing is, you can go there at any time and do an operation if it would be necessary. You can do any kind of therapy despite the gold implants. You can do MRT, because the gold implants are not magnetic, you can do everything despite the implants.
Du kannst jede Art von Therapie trotz der Goldimplantate machen. Du kannst MRT machen, ja, weil die Goldimplantate ja nicht magnetisch sind. Du kannst alles machen, trotz der Implantate.
How many out of 100 people who have already done this still need an operation at some point?
Well, if you need an operation, I would remember 1 or 2, we know. That's not a lot, right? Yes, it's really not a lot. We know from our research and also from colleagues that about 5% have no success, but you always have to remember, people don't come to us at the beginning, they usually come when it's so advanced that an operation is necessary. The others, we know that about 80% of patients have improvements between 80 and 100%, that is, they come from the pain scale from 10 to somewhere 2, 3, or some come from 6 to 0. Some have pain in their back or can't sleep at night. How often have I heard patients who said, I can't lie on my side at night because my hip hurt, now I can sleep, I can straighten my hip, before I always had to put a pillow under because it hurt. All these things are gone. We can also explain this on the basis of patients who have gone through all this, and that is simply a massive gain in quality of life for people with a minimal intervention. I personally found that fantastic, because I always try to treat patients so that we leave the body as it is, regardless of whether they come with chronic pain, that he can heal himself or here. If the thing is broken, the knee or the hip, then it is broken, but you can still help because the pain you feel comes from the capsule. If I put gold around the joint capsule and the pain stops after a few weeks, then it lasts. That lasts for years, that can last a lifetime, and I personally find that fantastic because it is simply a chance for people with minimal methods to restore the quality of life they had before.
Of course, I don't see a lobby behind it either. Which interest it is to invest millions of advertising capital here so that everyone knows who is already interested in spreading this technology, this idea. How did you come up with this idea? How did you come into contact with this child?
I saw a colleague who gave a lecture, Dr. Melanie Intrizzi. The colleague works in Düsseldorf. She started it. She can tell her own story soon, but I just assume she had a serious car accident, destroyed her knee, and was unable to work as a surgeon for years until she got to know the gold implantation that Dr. Kierkegaard, the first human in the world, had performed on people, a Danish doctor, and then she could walk again, she could work again, she was able to stand at the operating table again, and then of course she also started to do gold implants with great success. I saw the colleague, I was fascinated by it, because my focus was always on helping people without destroying anything. Then I thought, okay, I think that's fantastic, I'll try it out, because neural therapy, the way we work there, I'm used to it, I've done thousands of treatments and then over a year and a half accompanied her, looked at how she was doing it, learned it, and then I started doing it and saw how fantastic it worked for the people.
Dann haben wir angefangen, also habe ich angefangen, das zu machen und habe gesehen, wie fantastisch das eben wirkt bei den Leuten.
This is a great achievement of Dr. Kierkegaard's colleagues to have introduced it at all. In the meantime, we have also been investigating it since 2002, how it works, it is still being researched about it. We have known for centuries that gold has anti-inflammatory effects and it is a very nice process, but as you say correctly, in school medicine you go other ways.
In der Schulmedizin geht man eben andere Wege.
But we also need both. There are also people who need a new knee or they need a new hip. If someone has a hip necrosis or if the bone is completely destroyed, then you have to make a new joint. It's not like everything in life is black or white. These are blessings that we can do that. I can even give a patient 2, 3, 5, 10 years until he needs a new joint. Others never need one. But since you can't replace joints as often as you want, 10, 15 years can help a young person a lot until he needs a new joint. And at the spine, what possibilities do you have? You go there and stiffen the spine. You build in some steel rods there, steel rods or titanium rods, which prevent the spine from turning. But the problem is that you get stiffer and that usually above or below the staff after a few years, the pain really starts. I can at least try to prevent that by putting gold on the facet joints. Minimal effort, people don't notice it and they have a real chance that they will be painless for years or even permanently. And if only the pain is reduced by 50, 60, 70%, that's a huge gain in quality of life.
I have a hypothetical question. If someone had an operation and in order to speed up the wound healing process would put a gold implant because there are often inflammation processes in the bones, tendons, vertebrae, and so on, then would the inflammation that could be caused by the operation and the healing process be stopped again?
Hier auch ständig eigentlich diese Entzündung, die es geben könnte durch die Operation und den Heilungsprozess wieder gestoppt werden können, oder?
If the inflammation process after an implantation is caused by people having, for example, a titanium intolerance, then that's something else. I have also seen that patients after classic screw-ups lost their foot, their soles, then you have to go there and take the stuff out. But if the complaints still persist for whatever reason, because there are still residual inflammatory processes, I can do a lot with gold. I can just put it on the places that hurt and then the rest of the complaints usually go away. That's feasible, that's not a problem at all, and you can put gold after implantation. But you can also do all other therapies after a gold implantation. So if someone needs an acupuncture or a syringe or whatever, you can do it all. That's not a problem at all.
We have here, I would like to ask the director to put on the computer the gold implant. Fine gold 24 carat, no mixtures, nothing else, pure, soft gold. And these are the little sticks that you just put in with a syringe to the right point.
Exactly.
Neck vertebrae, we know that. We have already shown that. Here the X-ray. Here you can see all these points.
Yes, exactly. You have to tell the radiologist that you had a gold implantation. Then he will know that it exists. Then people think they come from the war. And now exactly these parts there. These are usually 3 gold pieces per point. And they just give ions in here, to the capsule, not into the joint. If you put that thing into the joint, then you have sand in the joints. You can't do that. You put that on the capsule, because that's where the inflammation process and the pain also takes place. You put that on the capsule from the outside and then the ions are released and prevent the cells, the immune cells, from simply spilling out substances that cause swelling and pain. NFK. There are various substances that you know, the university studies have all shown, that gold blocks this release of these inflammatory substances permanently. That's the effect.
Unbelievable. And very important nowadays, I think, everything explodes. All these orthopedic operations explode. I once saw in our area how many operations they have done in 4 years.
Yes, that's enormous. If you look in Germany, there are hundreds of thousands. There are over 400,000 operations alone on the knee and hip with joint replacement per year. And if you think about it, 10% of the people have to get it changed. In some cases even more. That's not easy. That's a really heavy intervention that knocks you out over weeks, which requires a rehabilitation of several weeks. That's something a young person can handle, but for older people it's not always that easy. Then you also have the possibility, if you're in the hospital, that you theoretically have the risk of getting hospital germs. That doesn't happen if I do an operation like we do, ambulant in the operating room, and an hour later it's over.
That's a very sensitive topic, hospital germs. You don't even talk about this topic, but if you look at the statistics, how much antibiotic resistance and so on build up in the stay in a hospital, you'd have to be serious to talk about it. Very, very bad. What do we see here? There are knee pads, but I don't see any.
Many patients have knee pads. Many patients also have an arthrosis under the knee pad. They not only have the arthrosis between the lower and the thigh, but also under the knee pad, which hurts a lot. They often have pain at the tip of the knee. Then you have to provide the knee pad with gold so that the capsule that sits there reduces the pain.
You can do that too. Incredible. Lumbar spine.
Yes, that's a big topic. You know the thing with the lumbago and chronic lumbalgia. Those are the people who always have pain down there. They then pull into the pole, pull into the legs. Then there are sometimes the little holes where these yellow things come out of the nerves. They are a bit overgrown here at the joints that are nearby. There is arthrosis. These are permanent inflammations that permanently torment the patient and that you can't actually treat in medicine. Sure, you can do acupuncture, you can inject procaine, you can inject CT-controlled cortisone. That all works for a while. But if you want to have a permanent solution, then you put gold on the facet joints and then the chance that it is permanently over is very large.
Would you put the gold implant around here or up here?
Here on the joint capsule. From the outside to here. To there. And always a little higher than the pain itself because the nerve supply also comes 2-3 segments from further up. So that everything is switched off, you can put it there. And the people don't notice anything. They have their full mobility. Here you can see a crooked spine. Normally it is a straight structure like a bamboo trunk. And here it goes to the left and to the right.
Genau. Ja.
On the other side, the other way around. The people have permanent complaints. The back is not straight. And even these people you can help with a gold implant to alleviate their complaints or even to get rid of them. This is a fairly straight spine. This is what it looks like after the implantation before you have cleaned everything. This is a minimal intervention. Here we have a shoulder joint arthrosis. This is also a patient who had severe pain. Especially the shoulder can of course also be replaced, but not so nice. These are the green points where I have marked. This is just a part. Here you can see what it looks like after the implantation.
And now you just have to have patience for 2 or 3 months and then it is tolerable. You once told me that this is actually nothing new. Animal medicine has been doing this for a long time. So as a Swiss, if I had such a problem, I would have to go to veterinary medicine and say, put a few implants in.
You can do that. But he is not allowed to.
But he knows that.
He could do it without further ado. It's incredible. In Germany, there are a lot of veterinarians who do this. They often send their patients because the veterinarian says to the patient, "Why are you honking?" Or vice versa, the patient then says, "You did that to the dog, can you do that to me too?" Which of course he is not allowed to do. And then the colleagues often send the patients to me.
So even animals would have the chance because of the problematics in the walking apparatus. I remember we used to have a shepherd dog. He also had problems with his hip.
That's where it started in 1975 with the hip dysplasia in shepherd dogs. Dr. Dorks tried it, had great success. It is now being done worldwide. It's not a problem with animals, only with animals it's more complicated. They are put into full anesthesia because they don't stay still. I don't need that with the patient, I do a local anesthesia and that's it. But it is done worldwide with animals, with horses, with dogs, with cats, I think. There is a colleague in Germany, an animal doctor, who also does it with large animals.
Here you can see where the lobby is involved and where it isn't. In animal medicine, the animal's well-being is in the foreground. And here there are conflicts of interest among people, where economic components are involved. It is understandable, I understand it all, but it is important that we show perspectives from a naturalistic point of view, which would also be possible. But with such success rates, that's something. We really have to see how we can build a network of medics here, also a platform where the Swiss, the Austrians, the Germans can go and something like this is offered. You are in the region of Saarbrücken, not so close to us. Or someone from Munich would also have his problems to come to you. What is your idea? What do you do to make it widespread so that there is a network of doctors who offer this?
I founded the European Academy for Gold Implantation, where scientists, where other colleagues come together and, as soon as Corona is over, can also train doctors. Simply to bring the process into the world, but also to research scientifically and also to control statistically. We work with people from the University of Saarland, who also process our data statistically so that you can see for yourself how it works. Is it something that is suitable or is it junk? We have seen so far in hundreds of cases or thousands of cases that it really has very good effects. We ask all patients, not only me, but also Dr. Entrizzi and other colleagues, how it worked, how the pain scale decreased, so that we can see that it also helps people.
Wie hat es funktioniert? Wie ist die Schmerzskala gesunken? Damit wir einfach sehen, dass das den Menschen auch hilft. Ja?
It is a process that represents a wonderful, let's say, non-invasive method to improve the quality of life, the pain, and all that.
Nebenwirkungsarme, nicht invasive Methode darstellt, die Lebensqualität, die Schmerzen und alles darauf zu verbessern.
Well, I hope that we will somehow see that you are in Switzerland periodically to do this or periodically in the region of Munich and so on.
I have a residency in Frankfurt, in Saarland, and plan was also Switzerland. I also had a location here, but because of Corona everything has been counteracted.
But that will come again, and we'll see how other doctors can call in to deal with it. If colleagues feel addressed and say, wow, totally convincing, do I also have to offer? What is the next step for these colleagues?
Well, the colleagues have to go through a regular training in order to also receive the certification to be allowed to do it.
Halt dann auch die Zulassung oder ja, die Zertifizierung zu erhalten, das machen zu dürfen.
Because I can do everything as a doctor, but I also have to prove that I can. If I treat people with it, then I have to be sure that I do it professionally, that I know exactly what I have to pay attention to, how I do it. And that just needs experience and training.
But the Academy offers that. And if a viewer says, I've had pain for 10 years and I want to read a little more about it, get more experience, is there a platform where you can read a little more?
Yes, there is the website www.goldimplantation.de, that's my page. There is also gold implantation for people in Germany. If you enter that as a search term, then you come to a platform by Ackermann. This is an organization that takes care of this matter voluntarily, which has also colleagues who carry out the gold implantation and so on. You can also get informed there. There are a lot of things. There are also studies that you can read, but you have to do that in English, and that's just medical terminology. One has to understand that. But there is still research in this area with great results.
As research, I know that you have to do it and that ultimately it is the legitimation to get into the mass. But I'm with the experimental medicine. Who heals is right.
I've been doing things for years. I started 17 years ago with bioresonance because I had allergies for decades. You also said yes, but that is not scientifically proven and blah blah blah. That may be all, but if it helps thousands of people, then I can't wait until the 500th critic is still convinced, then I'll just do it. Because if I don't hurt anyone and give someone the potential chance to really experience healing, then it is justified. And we monitor everything we do by doing labs, by making inquiries, by controlling as extensively as possible that it also works. And then you also have the right to say, okay, that you can carry into the world. You can work with that. In the end, the success proves us right. Because usually the patients come from all over the world and they don't come for fun, but when someone else says, man, that helped me.
I think that must be an incredibly nice feeling when you can help people so much.
Yes, that's why we do it.
I also wish from the bottom of my heart that this idea, this technology can also be widely spread to colleagues, that it is widely used everywhere, because it is a blessed concept. And that really helps in this sense. Thank you very much for your energy and strength to carry this out. And you too, dear viewers, the goal of this show was simply to present it in a different way, to present a different possibility of what you can do with really such arthrosis complaints, be it in the back, be it in the foot, be it in the fingers, in the cervical vertebrae, and everywhere there would be the possibility to do something with gold implants. Which now does not ultimately have a chemical effect. Actually, it is chemistry, or physics. The gold implant works physically, through the ionisation, doesn't it?
Yes, it works gene regulatory, as we have known since 2012. So it regulates the expression of inflammatory substances genetically. It works immune regulatory, i.e. also immune cells that emit inflammatory substances are dampened, but it works locally. It's not like the city puts the gold in and the pain stops up here. It works locally. But it works gene regulatory, immune regulatory, and so on. That has been proven quite well by now. So it's not the acupuncture effect through the stab, but it's actually the gold that works.
And side effect free.
Yes, thank God.
And these are really good approaches, instead of acting with chemical tablets or pharmaceutical tablets, which are also a blessing to reduce pain, but ultimately do not fix the cause, but only act on the effect level. And ultimately also a great chance, the gold implant suggests, to prevent an orthopedic operation. And I really think that's something incredibly nice. In this sense, all the best, see you next time and take care.